It's Andrew Dowling here and Mitch Kurtz. Thanks for joining us for another episode of the AltMed podcast. Make sure to hit like and subscribe because we have way more content coming out. And you got to stay up to date with it.
It was good until you did that.
Okay. Sorry.
Hey guys, welcome back to another episode of the AltMed podcast. My name is Andrew Dowling. For those of you who haven't listened to our prior catalog of 100 episodes where I introduced myself at the start of each one. Equally, if you haven't listened to all our podcasts, you wouldn't know that my co-host, as always, is Mitch Kurtz, but Mitch is in the house. How you doing, Mitch?
Apartment, actually, but yes, well, thank you. How you doing?
We've got a couple of, feel weird calling them guests. They're our friends in the industry, but we'll say guests for now. It is none other than Mel Wentzel and Mimi the Green Queen from CoCo Medical Education and Consulting, where they are the co-founders and directors of that business, and they just know a lot about medical cannabis. So they're a really good fit as guests for this podcast. Welcome, guys. Great to have you on.
What an intro.
That's awesome. Thank you for having us. We're excited to be here and chat with you guys.
Yeah, likewise. Well, do you want to each of you take turns just telling us, because I know you both come at this industry from totally different humble beginnings, but yeah, maybe we'll start with you, Mel. Can you take us through how you fell into medical cannabis?
Yeah, absolutely. My love story with medical cannabis. So my background is actually in psychology and project management. About sort of 6 years ago, I moved into this space where I realized that impacting policy and really driving change and transformation in healthcare was where I wanted to be. So for 5 years, I did that in quote unquote mainstream healthcare. So I did that from within the system, kind of driving policy change and working towards this beautiful value-based healthcare system. And then I had the beautiful opportunity to meet Mimi, who, essentially said to me, you need to be in cannabis.
When you get an order like that, when you get a directive from the Green Queen like that, you just have to comply with it.
Absolutely, 100%. And immediately I was in. I was like, sweet, 3 weeks later, I was in. And that was January this year. So we're really talking about, sort of six or 7 months in the space and loving every minute of it.
Beautiful. And over to you, Mimi.
Thank you very much. Nice to be on this finally, Andrew and Mitch. It's been a long time coming. So obviously you do know me for a little while. I have been in the cannabis industry for 3.5 years. I have a preceding history in pharma. So I am a registered pharmacist for 10 years on APRA. I've then started in pharmacy, gentle and, humble beginnings, and then quickly found out that that was not really my space. I then entered generics as a sales rep, and I thoroughly enjoyed my time there and really grew. And then also did a stint in surgical repping. So I've also assisted doctors to implant screws into spines. So that was a very exciting little time of my life, but very quickly found out that that was not really where I wanted to sit. And then I looked for a little bit of time for a space that I really wanted to be in. And it was either going to be aesthetics and, doing implants, or it was going to be medical cannabis. And I was very lucky to start my ride in Montu as a doctor rep. And then I had an amazing time in the last 3.5 years learning an incredible amount, but utilizing my pharmaceutical skills to train doctors and how to access cannabis and also how to treat patients. And then since that time, I have learned a lot about more than just cannabis as a medicine, but really how it affects patients and the things that it does for quality of life. And I've become more than a true believer, but somebody who really tries to break down stigma associated with cannabis itself. And then as we, led into this little story, I was in a bit of a different time and posting on my LinkedIn, and I got this amazing kudos from a woman online who pretty much was like, I absolutely like adore what you're doing. I'm so grateful that you're, speaking openly about some of the things that you're doing. And it was literally just a high five moment between two women. After a few months of back and forth, it was like, it's now time to actually meet. And in a local coffee shop near my house while somebody was on the way to IKEA in, let me not hide this factor, in some Daisy Dukes shorts. We then decided to meet and have a coffee. She's hiding her face, but she really shouldn't. Those are her signature Daisy Duke shorts. She then came in, and I knew instantaneously that was definitely a space. I truly believe in healthcare overall, and I believe in the power of cannabis and what that can do. And obviously working with large numbers of doctors over my time, I said, you and I need to do something in the future. And lo and behold, had no intention of, creating our own. But we knew that we needed to do something to really change the trajectory of where cannabis is going, and also be a really big part of the preservation of the medical component. As we all know that there is speak about legalization in Australia, and especially this week as well, there's been a lot on the news about it. We know that there's, significant movement, but cannabis is a medicine. I use my famous quote, you would never give an epileptic a prescription and say, here, go ahead and go choose a whole bunch of stuff and figure out what works for you. It's always coached, and there is an element of pharma here. And so, we've decided to come together and utilize our skill set, obviously mine from the cannabis space and Melanie's from True Healthcare, and implement that together and really create something that can help to create everlasting, legacies within the cannabis space here in Australia.
I love it. Do you think it's kind of dovetailing from what you've just described, but we know inherently that cannabis is a medicine. Do you think if it were ever legalized, that we'd find ourselves in a situation where, notwithstanding that, similar to other jurisdictions around the world where you can, go to a retail environment off the street and purchase products, do you think that there'll always be a way that, even though you may be buying it for a non-medicinal use, that we would still be trying to inform people that, oh, this is actually a medicine that you're choosing to use recreationally, rather than this is a recreational product? Do you guys have any thoughts around that?
Absolutely.
Yeah,
Absolutely. We talk about this all the time. So, personally and politically, Mimi and I are absolutely open, speaking for both of us, memes, but we've had this conversation 100 times, are really open to rec. And we think that access to the plant is a great thing. And that can mean a lot of different things for a lot of different people, but preservation of the medical market and preservation of that medical ethos around the use of cannabis is so important. And now is the time that we need to do the work to preserve that, so that when rec does come in, or adult use does come in, that the medical market is preserved, and all of the investment that's been made by everyone who has been fighting at the coalface for the last 5, 6, 7 years, all of that effort and investment is maintained. And from a patient perspective, so that even though, because we know that rec users transfer over to medical use, or we know that people who are using recreationally are using it to self-medicate, whether they're aware of it or not, that medical messaging and that really responsible and ethical approach to ensuring that people are informed is paramount. So absolutely, that will happen. But the work that we want to do now is around preserving, really creating, strengthening, embedding, and then preserving that medical messaging and that medical use.
And, if I may add to that, right? When we look at the recreational market and that people coming through, where they find a benefit, there's still not appropriate use. So that's, a lot of the time where my pharmaceutical skills kick in, because, lowest effective dose is always something that, we want to propagate. And there are ways in which people can use it appropriately to help themselves for a lot more benefit. And recreationally, we seek a different kind of benefit, if you want to look at it. But when you look at it in the medical sense, there is a lot more relief, a lot more control for conditions. There's so much more that can come from appropriate dosing and appropriate choice of formulation. And more so, what I have been very interested in over my time, because I like to look at things from a very different lens and a different eye, is the trending of a patient. So what is it like when they enter, whether they are recreational or a true medical? And by true medical, just meaning they have had minimal touch points in the recreation element, or they've maybe tried it once or twice and found that it helped their anxiety or helped their sleep or helped their pain in particular. You know, when they come through as a, like, into the medical market, how you journey through as a patient and then come out to be almost like what we would use the word connoisseur, or, you know, somebody who really knows what they want out of cannabis. That journey seems to be very consistent over the 12 months for patients. And so when you are able to instill the education that's around the appropriate dosing, or the education that's around the appropriate formulations to assist with condition management and condition control, that's when we yield positive clinical outcomes. And positive clinical outcomes is what actually leads to the quality of life improvements, whether that's functionality, mobility, just an overall improvement in their condition itself. Then that's where you're yielding the absolute benefit of the plant and what, you know, what benefit it can give in terms of relief, in terms of control overall. And so patients themselves still require education. Recreational users still require education to yield the appropriate benefits.
Totally.
Yeah. I've got something else I'd love to add to that as well.
I love it.
I think means if we think about the patient journey and the patient experience, and linking on to what Mimi's saying about different types of cannabis users, if we let the medical market fall away when rec comes in, we're doing such a disservice to patients, because there are people, because of stigma, because of knowledge, because of awareness, who have true medical need, who have chronic conditions that would absolutely benefit from cannabis being a part of their protocol, who just won't touch the rec market. So we still really, really need GPs educated about implementing cannabis as a medicine for those people, because you might have, you know, not to throw a stereotype, but you might have Nana Mary who's got chronic arthritis. She is not going to grow her own, and she is not going to roll down to a dispensary, right? But if her GP, someone who's managing her chronic condition, or her nurse practitioner, or her care coordinator, or her Aboriginal health worker says, look, it's great that we're doing these and we're taking a really beautiful person-centered approach to your healthcare, something that may add value in terms of managing your pain and XYZ is cannabis. Are you open to that being something we explore? If we let the medical market fall away, those patients miss out. So we're really not being inclusive of all people. So there's that to think of as well.
Totally.
I think that even though, you know, just to put another lens on it, if you look at North America, which is a very developed market, there still is a medical market over there. You know, we've had, for example, Bonnie Goldstein on the program before, who's amazing, but, you know, she's competing with a very advanced recreational market, but there still is a need for practitioners, even in, let's say, if Australia was to go recreational. Do you have any thoughts about, you know, the balance of that and how that might play out in Australia?
And is it fair to characterize that market, to your point, Mimi, as they're going for in the medical side, the lowest effective dose, and in the recreational side, in some instances, the highest non-effective dose?
Yeah. Look, it's great that you brought up North America, because Mel and I have spent quite a considerable amount of time kind of mapping out America and how it works. And I'm talking about hundreds of hours of mapping this out. And what we have found is that the Australian market is actually very special. You have a truly supported care journey. Although, you know, when we have large volumes of the recreational patients coming through, or those who've had recreational touch points, what we tend to find is that they don't necessarily want this coaching. When you look at North America, your access point is specifically only to get access to cannabis, and that's how you're enabled. But nobody looks after you. Nobody checks up on you. Nobody's wondering if your choice of medication is the right and appropriate one for you, whether or not, you know, is it an uplifting strain? Is it something that's really not making you functional throughout your day? Do we know that there is an ability to keep a patient really functional throughout the day, give them an ability to have extra creation, take off a little bit of social anxiety? There isn't that care factor. There's no supported journey throughout the way. And what that does is it opens up this market where people are taste testing, and their journey along the way is not educated whatsoever. And what we see here in Australia, because of the prescription and because of the element of access only allowed with your doctor enabling that access, what you find is that patients actually yield what, in my opinion, more benefit faster, and they're able to control. And in my history of seeing thousands and thousands of patients coming through, what you can actually find is, patients significantly reducing off of their other pharmacotherapeutics. And some of these pharmacotherapeutics, include things like their cholesterol medication, their blood pressure medication. We see improvements in things like the diabetes. And not that I'm propagating that this is exactly what it does, but this is what I've actually seen. So anecdotally, we get to see a lot more benefit, and we get to visualize this benefit very, very fast, as opposed to other markets where it could take months and months of somebody trolling through the system. And that's why I brought up very early, you don't see anybody who has seizures going to a doctor and then coming out and going, okay, well, now there's 12 options here. How about you decide which one you're going to choose? And if it works well for you, that doesn't work. What happens to somebody who does have seizures? And do they withdraw off their medication? Do they start their medication with their cannabis? There's no supported journey. And I think that that's something that we really need to preserve. And it's also the reason why there are a lot of investors internationally looking at this market. We always see it as the money factor, but it's actually quite special what we have here, and the continued journey, as cumbersome as it might seem for those who think that they don't necessarily need it. The option here is you're still supported, and you can still have a conversation with somebody to say, no, this is not working for me, or I need something else, or I don't like the taste of this. And that person is kind of educated a little bit in the market choices that are available. And that for us is really, really special, because to me, when we look at North America, yes, it opened up, and yes, there are lots of dispensaries, but who's your first port of call? Like, I'm not dissing any bud tenders, but is your bud tender the equivalent of a pharmacist? And is the bud tender really equivalent to somebody who can manage your actual indication and manage your actual condition? And how can they create benefit for that when we have the potentiality that is there and available with cannabis? And I'm such a true believer, because I've seen so many people's lives change from the use of cannabis, including like myself with migraines and my migraine frequency. What you really begin to find is, if you have that supported journey, the clinical outcomes or the yield for positive benefit outcomes and for keeping up functionality within your daily life is superseded than one where you have to try and, navigate yourself. For example, like when you want to have, when you want to work out, people employ a personal trainer. When you want to get better at your finances, you have a financial planner. Oh no, but when you get cannabis, let's just go out yourself. We kind of need to still have the coaching in between. And then that is really comes with education, and then it comes with understanding, and then the application, and all in it together, we can see the true benefit of the plant. And that's why we can saddle it in the medical space with its medical outcomes. But that's also the reason why, hand in hand, we still need the coaching. And for example, just to keep, because I can talk about this a lot, sorry guys.
Love it, Mimi. Keep it rolling.
Yeah, I was gonna ask you if you've thought about this at all.
Oh, Mitchell, how dare you?
We talk about strain tolerance. Obviously, when people go onto the black market and you're picking up, okay, perhaps it's in a little baggie, it's in a little Ziploc, no expiration dates, but you sometimes don't really know what you're getting. It tastes a little bit different, tastes a lot similar, maybe it was a lot hotter, you got a better high from it, but you don't really know. So you're constantly rotating. So even the next time you have a small batch, you feel it very quickly. Now, obviously, in the medical space, we have a different lens with that as well, too, because we want consistency. So people to use the same medication, but cannabis itself works differently, and we can build tolerance to that. And so based on that, we kind of need to have a little bit of rotation. So also our access with our prescriptions also enable us to have a couple of different solutions that work well for us, but by rotating them, we can yield the best benefit from them as well too. So I think
No, I love it, Mimi.
I love it. I'm gonna throw a couple of questions back at you though. So
here we go.
When we talk about, the examples you gave, say a financial planner, some people use, people in their trusted network that'll give them financial advice. Some people use a CA for getting fitter. Some people use a personal trainer. Some people might use, a physio. And there's different levels of kind of, let's say, training on their behalf, depending on how full throttle you want to go. So from the cannabis side, I mean, there's plenty of doctors that don't know about cannabis, and there's plenty of people who aren't doctors who know a shitload about cannabis. Where do you draw that line between somebody who's passionate, let's say, versus somebody who's medical necessarily?
I'm happy to jump in on that one, Memes. I think because we're talking about the cannabis plant, but we're talking about, and it is one plant, but we're talking about it in two different lenses. So we're talking really about you. I completely understand and support what you're saying, Mitch, 100%. In terms of just clarifying it, someone who we can define as medical is someone who has had medical training. And someone who has had medical training, particularly around cannabis, because it's not just the plant that you need to know about to give medical information, medical education, and deliver medical care. It's a medical education, and it's a medical knowledge and a medical understanding about the body, about chronic conditions, about other medications that people might be on. So I think that it's a spectrum, right? So at one end, you've got someone who wants to start using cannabis, or who has started using cannabis, who has no complex or chronic conditions, who's on no ongoing medications, who has no history of poor mental health, and who has no family history of potential poor mental health. That person, go nuts, talk to your mate, get your information, and talk to your peers. Peer learning is very valuable. Peer learning is valuable all the way along that spectrum, right through to people who do have chronic and complex conditions. But I think at some point along that spectrum, you need to engage medical advice and formal medical advice, because we are talking about the plant as a medicine. So it's really a spectrum, I guess, where you move the slider or move the dial along as is appropriate for you, because as everyone always says, and it's so true, cannabis is a personal journey. So I think it depends. The most appropriate advice and guidance, I think, should always be multiply informed by peers, but at some point, everyone needs for there to be some true medical advice that is informed by a patient's medical history as well. I don't know, Memes, your thoughts?
I mean, for me, I just, my history with doctors itself is that when we utilize a product more and more and more, we get to understand how it affects a patient. I mean, most of the things we read are very simplistic. I mean, what I would really like to see more of is, everywhere from sponsors and from suppliers and from manufacturers, sharing that understanding of what a doctor should expect a patient to, feel and to go through. And this is kind of where I think a lot of my close connections occurred, because I had the ability to speak to doctors about how their patients should respond to that. Obviously, the more and more you use, the more and more you see the results from your patients, the more and more you talk, that's how you know. It's similar to like a brand new medication or a tablet that comes onto market, right? They use it with the first few, the ones that they are good and comfortable with to ask the questions, the ones that are highly needing that. And then they understand the side effects, they understand the profile, they understand, the patient journey with that medication. So similarly, that needs to be kind of replicated within the cannabis space. And I think also too, it's like aligning doctors with thinking exactly like they would think about their regular, treatment protocols, because the moment they become comfortable to understand that it's just a new class of medication, and they still need to be affiliated with it, they still need to understand how it affects their patients. And many doctors, lack the ability to even touch and see and feel product. And that is something that I find as a significant barrier. Like, when you get a new tablet, whether it's Endo or all the way down to what was, Viagra and Cialis, they got little samples to be able to see. They gave it to their customers. I mean, we don't give samples out, and I understand that in cannabis, and I understand we're in an S8 space, but really having the capacity to see like what the color of the plant looks like, the smell, so that they can understand what patients are, kind of affiliating with, or what kind of things are resonating, is really, really important for them to understand. And I think that that's something that really kind of needs to be relayed to the vast majority, and it will come with education. Right now it's coming back in education from a patient who has used, who's sharing that. Again, it brings back the value of having a connection with the doctors, because it's also an emerging space, which means that there's a lot of education that needs to seep through and pass from one end to the other. There are a lot of recreational users who know more, and that is the truth. And we hear it continuously from patients. Oh, I spoke to that doctor and they didn't know anything. Well, there's still the access point at this point, and educate them. Tell them what it makes you feel like. Tell them how it makes you feel, because how else are we going to do it? Doctors don't try everything. They don't try 7 cholesterol medications for themselves. They don't try 7 hypnotics to see how it makes them sleep, or 7 anti-anxiolytics. That's not how it rolls, even in regular healthcare and pharma spaces. So what we need is like a sharing of how it makes you feel and what it does for you, because again, it's still individualized medication. So some people will feel very different to other people. And then that also bodes into the THC percentage. So many recreational users will come in with an understanding of, I need between 25 and 30%. Is there anything above 30%? Can I have some bubble hash? These are things that we see very often and very regularly in the treatment space. But really what it is about having good quality product. People understanding what terpenes do for a product, and how higher percentage terpenes actually will, give you a better overall experience with that strain. But that comes with a lot of learning and a bit more time. And we're still in infancy in terms of our emerging space. And based on that, noting that there's still such a small handful of prescribers in comparison to the whole that are still taking this up. You will get specialists and some doctors that really take the understanding, but there are still a lot that need education. And I think the education needs to come from all angles. It needs to come back from the patient. It needs to go from the doctor to new patients. It needs to come from manufacturers and suppliers with appropriate documentation. And in some spaces, I really believe, and I think the benefit will come is when doctors are actually able to see the product itself, touch and feel, have a bit of a smell, and be able to talk to a patient like, yes, it comes in a white bottle, because they know what your generics come in. They know what your original brands come in. They understand that those are things that people kind of assimilate, like they understand it and they know what to look out for. And I feel like just doctors kind of lack that. There's a big barrier for them.
Yeah, definitely. And there are some doctors that have, that have medical cannabis for themselves and vaporize that can talk to that. But sorry, I know Mitch is champing at the bit. I can see that look in his eye when he's got.
I just like when the quality thing comes up, I want CoCo medical education and consulting to explain to us what makes a good product. Like what, how do you define quality from your end? You've been around plants in multiple ways, and I'd love to understand, where does quality come from for you?
Mel, do you want to go first, or do you want me to rattle on here?
Oh, I was sure you were going to dive all over that one.
I was looking like, firmly at Mimi.
Talk. Yeah, absolutely. Go for it.
Green Queen, might I add.
Yeah.
That's it. That's it.
Look, good quality product means from the seed, from the breeding, the cultivation, all the way to the packaging being, when it comes into the patient hand, so the entire journey being right. For example, good product is, well-grown product. People who grow it and cultivate it, really understanding how to rear this baby and then journey it on. Obviously, we live in Australia, so there's a lot of time before the product lands. Good quality product for me is like product that can actually give the promise of what the company is promising us, and whether that is in the actual high. And I think again too, it's individualized. Is it the quality of the high that's what the product will yield? Is it the condition control or the management? And depending on who it is, it can be very well like differentiated. So for those that want good quality high, though, I don't necessarily always think that a THC percentage is the final answer. And for example, we've seen some very high percentage strains in this country that, a lot of people would, bag on. And we've seen some lower strains that have done very, very well in terms of the quality. I also think presentation is really important, and the experience overall is also important. And we fail to focus on this because we're in a medical space. But when it comes down, it's really what the patient is seeking themselves. And there's a lot of feeling associated with cannabis. Cannabis is a very emotional journey as well too, because anything that can make you feel better, people have a bit of a psychology associated with it. They have a bit of an emotional attachment to it. But I think, I'm not the plant expert, even though I'm the green queen, Mitchell. You're the one who believes in the plant. But for me, good quality product is really, a good feeling at the end of the day, because that's, essentially what cannabis, like the way I would class cannabis is cannabis helps you to feel good. Cannabis helps to create community. It helps to create sharing. It helps to, take off the edge. And so when we look at it at that, when patients even experience cannabis, I think good, wholesome cannabis is something that is, well grown, well reared. Like, we are preserving things like terpenes for the benefit, because we know that terpenes host a lot of the, clinical outcome that then helps to potentiate the CBD or the THC to do its action, because the CBD and the THC are more like that receptor key lock there, the opening. And then we have these benefits that I don't think have been really looked at much. And, with more education and with more time, we'll find that, there will be more choices specific to conditions, to things that people want to control based on terpene and percentages of that. But we know that a lot of the terpene is lost during transportation, bottling, and even in growing and with other irradiation processes. So, it's a great question. It can be looked at in multiple different ways. From a rec user, it's really good quality product is a product that gets you high. I think good quality product is a product that keeps you functional, but a little bit buzzed, if that's what you can say. Because obviously, you have heard, I, love to coin a term in market, which is the high functioning cannabis consumer, the HFCC. And that's really
I know a few of those.
HFCCs. I think we know more than people actually let off. And so really, once you can find that sweet spot where you're able to feel the pain less, the anxiety less, the edge is taken off, you're feeling more functional and creative, but you're in a good space and you feel good, then that's the right space and that's a good product.
Could it just be functioning cannabis consumer, or do they have to be high?
No, and it's not high as in buzz high. It's high functioning as in I execute and I am out to win and I win it.
Maybe you could be a high functioning cannabis consumer.
High.
Oh, definitely. Definitely.
guys, I do want to ask, CoCo Medical Education Consulting, what do you guys predominantly get approached for? Obviously, you're working in the space now. We haven't had too many consultants on. I'm really curious to know kind of what it is that people are coming to you with. What are you guys doing?
And then I've got a question for Mel after this, because I know
No
okay,
questions
all right. We'll do the
for
consulting question first. All right.
my question.
All right, let me jump in on this one, because we've actually got some really exciting clients on the roster at the moment. So we started effectively, CoCo officially launched in April 2023. So we're really at this date of recording, we're like 3 months in business. Within those 3 months, just in terms of the volume of work, we have been approached. Now we support and provide consulting to mainstream healthcare, including the medical colleges, peak bodies, and also cannabis. To date, 95% of the interest in our services has come from cannabis. And in a beautiful turn of events, it's come from all the way along the supply chain. So growers, importers, not regulators yet, but that's a space that we absolutely intend to work in. Clinics, absolutely. Sponsors in terms of distribution and in terms of commercializing products like devices. So it's really beautiful to see that the interest is coming from right across that kind of journey, that plant journey. Happy to share some really exciting news One client that we're working with, particularly in the clinic space, has a global footprint. So we're CoCo have been engaged for 12 months to work on developing beautiful clinic models that will be implemented in different territories around the globe. And the first space we've been working in, and Minnie hinted at it before, is North America. So one of the beautiful pieces for us and one of our kind of milestone moments really early in the CoCo journey is that last week we just had approved and signed off a co-designed, person-centered, high-performing medical cannabis clinic model, the first of its kind in the US. So what we're looking to do is drive change in the US, taking the market, the cannabis clinic market, from purely an access point to get that card to a true supported healthcare journey. Really, really exciting. Once we implement that there, which is what we're doing at the moment, that will be coming to Australia and in fact, the UK. And I'm coming to you from Paris today, but I was in London last week and I'm back there in a couple of weeks taking meetings on exactly that. So it's a really, really cool thing for us to be doing.
I was going to ask Mel where you were. So you're in Paris. Holy shit, this thing's the model's gone global. You're just rolling it out wherever you go. I love that.
That's it. That's it.
I know that all sounds really exciting. And we know that for any clients, both here in Australia and abroad, working with you guys, they're tapping into just a wealth of knowledge. And the next question I have actually kind of touches on your, I guess, public health policy background, Mel, and your experience in those areas. But I don't know, as we were talking before a little bit about, the need for people or the desire to have somebody supervising your experience and for it to be personalized, it got me thinking about all the different, parts of our lives where we don't have someone there necessarily, kind of keeping an eye on, are we getting enough sleep or, are we eating the right foods? It feels to me that our current healthcare model really just caters to acute care need in the large part, and where I guess I'm interested in hearing from you guys about what you see as a potential policy changes and how we could approach health in the future. And also just if you can touch on maybe just your thoughts around how well you think people really actually know that how healthy they are. If their only idea of health is, hey, I go to the doctor when I've got inflamed tonsils or, when I've got this rash on my arm, how well do people really actually understand their health?
That's a great question. So the first thing I'll touch on with that is the idea of patient activation. So patient activation is a behavioral concept that measures a patient's knowledge, skill, and confidence in managing their own healthcare journey. And this is in wellness and in times of poor health. So if a patient is highly activated, they have a high level of knowledge, they know how to apply that knowledge through skill, and they're confident in applying that knowledge. So it's this beautiful trifecta of behavioral influence from within a patient. Patient activation is not a new concept. It's well published on, like very, very well published on. There's a survey out of the University of Oregon called the Patient Activation Measure. There's over 900 published studies using that measure. It is worldwide accepted as the optimal measure. And essentially what that does is it's a 10 or 13 item questionnaire that health services, doctors, clinicians, nurses, online health services can use. And the patient will receive a score out of 100 and then a level out of 1, 2, 3, and 4. If you're a level 1 patient, you're poorly activated. It means you're not particularly confident. You don't feel particularly accountable for your own healthcare. But as you move up that spectrum, you might expect someone at the other end to be engaging in their clinical care or in their wellness. So when they go to see their GP or their healthcare provider, they might be saying, great, look, I read this great article this week about XYZ, and I'd love to explore that treatment with you. So whether you measure it or not, every patient, every person sits somewhere along that activation line, that activation spectrum. And interestingly, more and more as it's published on, it's starting to find its way into healthcare policy. And it was actually listed as the first enabler of the Australian primary care 10-year plan that's just been implemented. So there's a real understanding now and acknowledgement from the regulators, from policymakers, that activating patients by educating them, training them with skills, and helping build their confidence, that the health system will benefit. So that's kind of the patient activation piece. Thoughts on that?
Well, I want to know how activated you guys are. It's a tough one because there's this movement towards, people doing their own research, for want of a better term, and maybe considering themselves to be activated and, very knowledgeable about a topic. But, depending on the quality of their information source, maybe they've been listening to some crackpots. I don't know what, Mimi, you're listening to all this. What do you make of it?
Look, I think we don't use healthcare for wellness. You can't really go to your doctor and say, oh, I feel great this week. Can I have a blood test, please? So that I can, this can be my baseline, right? We have kind of like a system that caters for your sickness. And that is, really unfair. The other thing too is we're, like in talking about us four, we're very much in the healthcare space. We're around people who are constantly delivering care and healthcare. So we're quite health literate. But there are many places in Australia where health literacy is very low. And that is where it becomes a problem as well with, accessing Dr. Google for every single option and, for trying to identify what is right for your body. We still need doctors around to be able to assist us, to guide us through care. And so I think I wish there were a lot more wellness opportunities for us to talk to people about wellness rather than medication or medicating, as well as, what Mel had taught me a little bit about is like social prescribing. So if you feel a little bit down, are there particular groups that you could engage with, like people who go for a walk, people who do hikes, people who do some meditation? Like, at which point can we enhance ourselves? And this is something that, another reason why we see a big change when people enter cannabis and do reduce off pharmacotherapeutics, because they are yielding a bigger benefit than just one specific element. Because when you have medication itself, there's usually a maximum of 1 or 2 active ingredients within a medication, right? These active ingredients are the ones that actually make a change to your body, and everything else is a filler, a binder, something, or an excipient that then exits out the body and makes no change to the body. Obviously, when we come into cannabis, you have CBD plus THC plus all these other elements, including terpenes and stuff and other cannabinoids that then can potentiate each other, where we get things like the entourage benefit that then can give greater benefit to the system. So I wish overall we had like an entourage benefit for, our healthcare system, where we can seek a bit more wellness. You can't go to anybody if you just feel good. Kind of, we're saddled ourselves in terms of our our healthcare system is catered just to help those that are sickly, and that's how we even classify patients according to urgency for even our hospital care. So I think that there is a long way, and I think that that's also why we see cannabis sitting around, wellness areas, people like spas and retreats, or people who are going to chiropractic, or people who are going to like physios. They're people who are generally, happy to kind of like invest in that wellness space, because it is, I don't think the healthcare caters for anything else but your sickness.
Yeah, I agree.
There's great news on that though. So I completely agree, and that's been the issue, right? That's been the problem with healthcare and healthcare systems for a long time. But in terms of the good news is that I can share is that there is movement. So healthcare transformation is very slow. We know that any form of organizational transformation, system transformation is incredibly slow. We know that, and it needs to be multiply informed. It needs to be informed by stakeholders from right across. In Australia, in the past 5 years, we've had some really exciting milestones. So 5 years ago, under Greg Hunt as the health minister, the National Health Plan was released. The National Health Plan had 4 pillars. One of those pillars was, the first pillar was improving primary care, improving Medicare, and improving the PBS system. Okay. And then there were 3 other fantastic pillars as well. But for us in cannabis, we are most closely linked to the primary care space. So that's what's of interest. One of the recommendations that came out of that healthcare plan was to develop a primary care 10-year plan. So primary care, for those who don't know, is pretty much your GP. It's your first line of healthcare, and it occurs in the community. The primary care 10-year plan was developed in consultation over 2 years with some fabulous experts, including the consumer voice. So patient voices were absolutely informed that plan. Then what happened 2 years ago is that, a year and oh God, time moves. 2 years ago, it was released for public and for other broader professional feedback for a period of 2 months. So the consultation draft of the 10-year primary care plan was released. It was sent to some key stakeholders. I was very fortunate. I got to review it and provide some thoughts and feedback. And mine is one teeny weeny voice among many, but it was a real pleasure and a privilege to do that. Then 2 months after, the final version of the 10-year primary care plan was released. One of the recommendations of the primary care 10-year plan mimicked what was in the National Health Plan, and that was to strengthen Medicare. So as soon as that primary care final version was released, 2 months later, they assembled the Strengthening Medicare Task Force, which was made up of about 15 different fantastic professionals, healthcare leaders, academics. And the job of the Medicare Task Force was to look at all of the data, look at all of the patient feedback, true patient feedback, national. We provided, where I was previously, we provided 10 years of patient feedback data. And then the Strengthening Medicare report was prepared. That was released, I'm going to say 3 months ago. And then one of the recommendations out of that was to create more person-centered care and look at kind of multidisciplinary teams and reducing fragmentation. So the messaging that's coming through all of this work, and it is a funnel of work that needs to occur, right? You don't just go out and kind of spatter policy development and see what sticks. It has to be built upon. So the really good news is that there is change. It's been thoughtfully developed and is being implemented over the past 5 years. It's informed by many really interesting voices, and really significantly, the consumer voice has informed it. And now the recommendations from the Medicare plan, they've just recruited about 6 weeks ago, a fantastic team, and they're now looking to implement that. We can also see that there's been changes to the PPS and how pharmacy is working. So change is coming, but change is slow. The beautiful parts about all of this change that's happening is that it amplifies the consumer voice. It's person-centered. So person-centered and patient-centered are 2 different things. Patient-centered refers to the person and their illness. Person-centered refers to the whole person. So that's where what Mimi said is sort of coming in around that wellness and around understanding what's important to that patient. And it links back to what Mitch said, what about peer learning? There's peers in the cannabis space who know heaps more than some doctors and most doctors, and all of that is true. So the person-centered healthcare journey, yes, you are a patient if you are within the healthcare system, but it now is looking to consider the whole person. And it's looking at integrating care, which means you're not having these different siloed clinical interactions. What it means is that the health system is integrated, and each of your care providers speak to each other. And beautifully, that now includes your potentially cannabis specialist prescriber. So if you have a GP who doesn't prescribe and you go to a cannabis specific clinic, we're now looking at making sure patient records are shared, referral letters are shared, of course, all with the patient's permission. But by doing that and by integrating that, the care journey for the patient will be better. And then all of that beautiful, very slow coming policy change will come together. But it absolutely takes time.
But arguably, there's no cannabis specialists per se. Like, you can't be a cannabis specialist. So
no, you're absolutely right.
So what is the real benefit in the cannabis world of that model? Where does the real, is it mainly that, if you switch doctors, they'll be able to see your previous kind of scripts, or is it like, what is the major benefit? Somebody, or will they be able to, claim something on their private health insurance or Medicare? Like where is the real synergy coming from here?
Yeah, such a good question. So really, for all of this policy and all of this structure that is being built, all has the person at the center, the patient at the center. So what that means is the patient is enabled to dictate their own healthcare journey. So what it will do is it will create an attitude, it will create a tone where the patient who is activated, which is what we spoke about before, is more confident and more able to drive their healthcare journey and to speak up and say to their GP, this is my choice. I'd like to explore this. Are you able to help me? If not, and when I say cannabis specialist, what I really mean is a GP who is working in a cannabis clinic, and who is kind of doing that full time, right? So for the patient or the person is at the center of their own journey, and they'll have more flexibility and be more enabled to make choices. Look, the practicality of it is sometimes and initially that will just be a letter to someone's GP saying, hey, I'm from XYZ clinic. Your patient XYZ with this birthday came and spoke to me about their anxiety and chronic pain. I've prescribed these medications for them. I'll continue to update you. Please call me if you'd like to. That's a good example of a really basic cross communication. But an even better example of that is when the GP rings and goes, I'm so glad you sent me that letter. Let's chat about it because I'd love to learn more, and let's talk about this particular patient. Now, in a healthcare system that is currently pressed for funding, and that is a fee-for-service model, that doesn't always occur, but it does occur. And it is occurring in probably, look, if I were to break it up, the current primary care breakup of who is high performing, who is kind of getting, so high performing, by high performing, I mean transformational, providing transformational care for their patients, putting the person at the center, working with them, considering them as a whole person, including their carers, their families, their communities. Aboriginal health does that beautifully, better than anyone else.
So just curiously, sorry to jump in terms of, and I hope I'm at liberty to maybe reference the fact that you both have experience with the patient system in
yes.
Australia. Where do you think, like in your own experience, what are the major pitfalls we're experiencing now, or where are the benefits? Like, what are you seeing is great that we're doing here in Australia from a patient perspective, and what could be done better?
Yeah, Mimi, you touched on this earlier with that beautiful supported and guided care journey that's facilitated by our script system. Let me throw back to you on that one.
Yeah, definitely. So I think in Australia, one of the benefits is, I mean, as cumbersome as it may seem when in the beginning for the journey to have the prescription there, I think at the end of the day, when you're having access and you're using it as a medicinal product, and noting that many people don't need the assistance, there are plenty that actually do require the assistance and that are on complex like medication regimens. They actually need the guided care. And some people are not recreationally inclined whatsoever, and they yield some of the most amazing benefits from this medication. And so the coaching and the supporting and having somebody to come back and actually check on these medications it's incredible, and we should really value it. I think it's been hard in Australia, and the negative parts is there's been a lot of hoops to have to jump through. And I think there was a lot of complexity quite a few years ago. I mean, we still talk of access still being a problem, and access is a problem because we have less than 10% of Australian doctors in Australia really educated and, really opening access to patients. And if access was not a problem, we'd pretty much have this prescribed at every general practice. But we don't necessarily see that. We don't even see that at the levels of your specialist, whether it is neurologists, psychiatrists, or pain specialists. We still don't see that. So access then is still a problem. But once it does become more mainstream, the thing is that we need to continue to have the guided care. And the guided care for me really settles within the first, and again, my opinion, but from dealing with a lot of patients and a lot of, volume of patients, the guided care is really only between the first, 6 to 12 months. After 12 months, patients really become their own self-guided kind of coaching themselves, and they allow with testing, and they'll try new products and they'll see what actually works better for them. But in the first interim, especially if you're somebody who's really holistic, so think of, somebody who, and I'm not trying to categorize anybody, I never do this, okay, in general life, but if you think of somebody who's, only goes to a naturopath, somebody, who really,
a wellness warrior, if you will.
who eats very healthy, perhaps, a vegan, and they're not the type of people who would really want in that way to be classified as a pothead, or to ever be classified in any terms or affiliated with cannabis in that use. They're using it for a very different purpose. And they're also the people who would love somebody to explain to them what they're expected to feel, how they're expected to feel, how much they should actually be taking. Some people, when it comes to things that they ingest, they treat it very respectfully, and they're not just going to take a few drops here and a few drops there, or they're going to follow a schedule. And we have to be able to understand that the system needs to cater for that, and that the guidance is definitely required, because what I have seen even in my time and working with patients who use excessively. So having a patient come through who uses more than 6 grams a day. I mean, obviously we look at that and go, whoa, that's not a true medical use. That's like a true recreational. But if you think about their tolerance, and we understand that that can actually happen, how do you then guide that patient? Because if you're a true medical officer, you should have the capacity to be able to yield those patients back. And those are the patients that are super exciting to work with, because they know so much and they can smoke so much or use so much. I mean, we generally won't have that access. And so working backwards with those patients was a real big eye-opener. But again, they still needed coaching, right? Whether that coaching came through, an MSL or a pharmacist being involved with the doctor, you yield the best outcomes when people can be told. When people are just left to their own devices, we see the range of everything, right? It's like almost pandemonium if everybody could just do whatever, whenever. But I am still a very big supporter of recreational and legalization. I think that creates a greater access point, but it is not suited for everybody. And where we can see, and the reason why Mel and I combined to talk so much about healthcare is because that is where I've seen the greatest potentialities for patients who really suffer, who have trialed and tested so much. And then also on the opposite spectrum, after COVID, there's been a huge change with youth and the younger generation as well too, with, being really careful about their choices, whether it comes to anything pharmacotherapeutically inclined. They generally don't want to do that. So, we have a lot of new kind of patient bases around with different types of psychology, some that are very averse to taking medications or pharmaceutical options, that now we have something in our hands that can really yield positive outcomes, and especially when used appropriately. And my biggest thing is it can be used with the least amount. It doesn't necessarily have to be the highest THC percentage, or 6 bongs or 6 joints, or 12 vaporizations in a day. It can really be tailored to suit somebody's day. For example, and not that I'm preaching any kind of prescribing protocols, but like making sure that you have an oil, because that's so long lasting and it's so much better for you. And when you have patients who consistently use flower, once they institutionalize their oils to their regimens, they get so much more control that they themselves will tell you, oh my God, this has changed my life. And then on top of that, having the capacity to have vaporized product for your breakthroughs, plus inhaled oils for using for portability, and for when people are on the go, and when people cannot sit down and have a 10-minute session on their Mighty. There are a lot of ways to tailor medical formulations and options, and as long as you're given the access point, you can really suit create regimens that really suit your lifestyle, suit your functionality, suit your need for creativity, as well as suit your need for an appropriate rest time, which we know, when coupled with many kind of conditions, like for example, pain, depression, as well as sleeping issues, we can start to see a greater yield in terms of the outcomes that we can get from cannabis as a whole.
beautifully expressed, Mimi. Yeah, no, I completely agree with all of that. And it is actually just, I don't know, just to tail on that, I mean, I find it really, really fulfilling to speak to people and hear about their cannabis journey, and sort of, having the reference point of where they started, what they've learned along the way, and just it is so personal, and the people that really invest in it and want to do it responsibly and properly, yeah, as you say, the potential is clearly there. Look, I hate wrapping up this discussion because it's been very, very enlightening. We might have to get Mimi and Mel back on the potty, Mitch. He's just nodding his head.
I mean, there's a vibrancy that is always fun to have on the show, and that usually comes from me and you, Andrew. But today we had other people doing it as well, so that was quite nice.
Had others bringing the high today. No, thank you so much to Mimi, as always, a green queen by name and by nature. Mel as well, who something's happened to her connection, or she's just seen something great in Paris and has decided to abandon the chat, which I would totally understand, by the way. Paris is a wonderful city. But we are so grateful to have had you guys on the podcast, and we'll have to do it all again. And we just, we love the work that you guys are doing, love the unique backgrounds that you guys draw on for CoCo, and in providing, quite a high level of expertise for your clients. And thank you so much for jumping on and sharing your insights. And we look forward to catching up soon.
Definitely. Absolutely. Thank you very much. It's always a pleasure to be around, some very special people in this industry, and you two definitely are, and more than just some people, close friends as well too. And we're definitely happy to do this again and kick up another piece of conversation. Just next time, let's keep it a little bit lighter. Maybe we can make a couple more jokes.
Yeah. I know public policy around health gets a little bit dry. There's a few topics I'd like to hit next time. I'd love to know, just, I don't know, maybe share some war stories around, what we all enjoy from our own personal experiences, what we didn't enjoy maybe. I think Mitch has got a green art story or two up his sleeve. But anyway, I'll let him tell that in the next episode.
Let me keep some credibility here. You've lost yours. You don't have to take me down with you.
Oh, dear. No, thanks so much, Mimi. And thanks to Mel as well. And we'll, until next time, when we do it all again, take care.
Thank you very much.
See ya.
CoCo Medical. Bye.
Bye.
Andrew Darling here, Mitch Kurtz here. Thanks for joining us for another episode of the AltMed podcast. And if you like what we're doing, please like and subscribe. We have way more content coming out, and it's all fantastic. Please.